Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Janae Sharp today, who will be shining a light on the good things happening in digital health.
I'm really excited to sit down with you today and to talk about your work. And you have a strong history with working at Children's Health CHOC and Rady's Children. I wanted to start. So you've built your career across some of the largest health systems in the country with leadership roles at Texas Children's, now leading IT at Rady's Children's Health. And before we get into this longer view, I want to ask how you think about the role of a CIO and Chief Digital Officer today, and how that role has changed as digital and AI have moved to the center of organizations. So let's start there. Let's level set.
Let's jump right in. All right.
Yeah.
Great to be here with you. I think the biggest change has really been, historically, the focus has been run the business, run the infrastructure. You do a little bit of enablement, but you keep things going, keep things running. And I think today that digital means a lot. It means really everything as it relates to data. It means everything related to how you engage your patients, patient families, and the workforce. And it means the two words that everyone either loves or cringes when they hear: AI.
They might do both.
You're right. There was probably both. And so that's really the biggest difference in what the expectation is. We're supposed to know all of those things. We are supposed to be able to enable the organization with AI, Gen AI, digital. We're supposed to do all of those things. But I think the other element of that is there's just an expectation that we are a real partner with operations, and we are able to align what their needs are with these technologies to drive better outcomes for their service lines, for our patients, patient families. I think that's the biggest difference. We're doing both. We're transforming, we're modernizing, but we're also keeping everything going.
Right. And I think it sounds so simple when you say it, but it's a huge job. And without it, you kind of fall apart. I think about this yesterday. I didn't have internet, so things just didn't happen. Right. But also, you're talking about anticipating people's needs. You need to not just keep things going, but also move forward. I want to talk a little bit about what differentiates a great job doing that and just having it on paper. Because a lot of systems might have a digital strategy on paper. They might have found someone to give that to them or have these ideals, but there are leadership changes. There are changes in, who's working there, the size of everything. You've worked through mergers, through all this stuff. How do you approach that digital vision that can survive so much change, not just with technology innovation, but also with people and everything? And what have you learned about getting aligned? So it's not just something you say you're going to do.
Right. So I think there's a few things that are really critical. The technology is important. Love the technology. So you have to have the capabilities, no doubt about that. But I think the other two things that are important is understanding why we're doing what we're doing. Operations is aligned with what the expectations are. What are we trying to solve? If you think about improving access in digital, we need to have a more efficient way for our patients to get access to appointments, whether it's primary care, whether it's specialty care. And if you align on, okay, we need to do this, then we get into, okay, well, what needs to change in order for us to enable capabilities? Is it just the tech, or do we also need to maybe limit how many visit types we offer? So if someone needs to self-service, find whatever appointment works for them by location, they're not going to see a drop down of 100 different visit types to select from.
Right.
So there's a lot of process optimization and redesign that also goes into it, and having everyone grounded in this is a people, process, and technology program or work, and not just a technology program to implement. Right. That's important. And the last piece the dreaded G word, governance. Having an executive governance group that is helping drive and prioritize what do we do now, what do we do next, and what is going to come later. Because that sequencing sometimes is hard because we want to do it all. But the challenge that I think people face is you can't always do it all. And if you try to do it all at the same time, then you don't really do anything really well. So having that governance group to say, okay, here's what we need to do first, and we're going to build upon it to get to that future desired state. And I think that's what, for me, is important and critical to be able to execute and do it well.
Right. I think too that's really relatable, like making an appointment online. Like, I don't want all the options. I just want them to anticipate what I need and for it to be fast and easy, preferably.
100%. I think the other thing I didn't mention is that people process and technology piece. The physicians who are going to see the patients, they got to be in the loop with this as well, because they may have to adjust their schedule, what's available for self-scheduling. Because if you get into specialties, there's some criteria that they want to understand to make sure that you're going to see the right physician for the right thing at the right time. So,
nobody wants to go to a specialty they don't need to go to. Like, or maybe you do, and that's not what we're talking about today. I want to talk a little bit about governance and what that actually looks like. When we're talking, you've done significant work with integration, with mergers, consolidation. When we talk about digital and data versus governance, what does it actually take? What does that actually look like to bring it together? And our audience is pretty technical too, so you can really say, like, what your top of mind is, what you think is important. And then I'm going to ask you another question after you answer about this.
So really what it practically looks like, particularly if you're trying to bring two organizations together, because everyone already has governance groups that are in flight in various stages and various levels of maturity. But you want to leverage that. You don't want to just throw it all out. You want to leverage it and then be able to create that overarching governance with representation of the clinical areas. You need physician representation. Patient safety quality is critical because we're here to deliver the best and the highest quality care. You got to have that. And then revenue side is important. And then some of the other operational, nursing, having those leaders really guide what is most important, what kind of insights do we need that we don't have today. And then once we understand what those needs are, then that governance group can really then drive what I call these sub-governance groups, which are the senior leaders in the organization that are the kind of domain experts. You need those individuals because they really help you understand what the different workflow challenges are going to be. What's the questions that they have to answer to run the day-to-day operations of their clinical unit, of their administrative area. They help you really understand that. So you're building this massive data lake architecture and platform that's really going to serve the audience as they intend. Not the way you want them to receive it, but based upon what their needs are. And so I think that's a key part of the governance that has to be in place. The IT team, I'm there to facilitate, but the most important part is the engagement from those leaders. Because once we have that, then it's easier for us to build out that platform and to start to enable and start to create a scenario where we identify operations folks that actually want to create visualizations off of those platforms. The hardest thing to do when you're creating these platforms is to get out of the business of being the primary dashboard creator. And it's
tough.
hard.
We love a dashboard.
Yes. And getting people, having it in a way in which operations and analysts outside of IT can actually do it. And it's not such a complicated endeavor and a huge time commitment and drain on them to do it. that's the part that has to be solved, and that's the approach that we're taking. So we have those creators. So even though we still build some, we don't want. We're building what you call maybe citizen developers, who are able to create their own visualizations, or as my director of analytics, Caroline Fager, says, they're viz creators, because she always has great names for things.
I like that. Like they're creators. They don't want to do everything. They don't want all of it. When we're looking at consolidation, before we move on, I want to talk more about those creators. But before that, I wanted to go back and think, when we're talking about this wave of consolidation, like how will this shape care in the next decade? Will we have more people in the workforce creating stuff? Will we have more, top down? What you can predict? And, we will hold you to this.
Well, all right, I'm on record. So I think if we're doing it right, and doing it well, the old way of the viz creators, you'll still have some of that, because there's always a real need to understand how we're improving and looking at that visually to say, hey, we've done these interventions, we're trying to improve care delivery and quality. Let's look at this in a timeline and understand the interventions, and are we seeing the outcomes? So you're always going to need that. But I think because things are moving so fast with AI and really Gen AI platforms, that the future state is going to be more about those platforms connected to your data platform, and you really using that as your analysis tool and your viz creation tool. So there's going to be so much democratization of access and creation using those tools. That's what I see the future state being. Not so much, the traditional way of, I built this platform and here is my click view. Here's my Tableau. Here's my Power BI. Those tools are important, and I've leveraged them.
Yeah.
But
we love you guys. We love all the data viz people.
I don't know that that's going to be the way. At least for me, if that's still the primary way in which we're doing visualizations and creating insights, then I have failed in what we're trying to get to. Right.
Although we love data viz, we love the Excel World Championships, we need more people to be involved in it to be more fun. We need to amp that up.
Because ask for what you want.
Right.
Prompt it out, and it's going to create that visualization for you. And if you need to refine it, then you can refine it. Or you're going to prompt it again and say, I need a different longitudinal view with the scatter graph, and because that's the best way for me to present the information, that's going to do it.
Right. Imagine having your own private data scientist available all the time for what you need. I love 100%.
it. You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
Let's talk a little bit about how you've developed that, because you've been driving this launch of private generative AI platforms to support administrative and clinical work. Is that correct? Yeah. So,
that is correct.
So let's talk about that. Why did you choose that private platform path rather than just the vendor, relying on one person? And how does that make it decision-making possible? Like, are people really doing this?
Well, yeah. So this is how we looked at it, and you'll hear me reference my director, Caroline Fager, because she really came into the organization.
I hope she's here.
I hope so.
This is her test if she's listening, right?
Yeah. Because she came in a couple of years ago and basically said, "Hey, here's what you guys have been doing. Based on everything I've heard from everyone, we need to do this differently." And so we went about this plan of creating a data platform that could serve our hospital operations, but also we have research data scientists in the research group. They have very particular needs. And then we have data scientists that are also, I'll say, hospital operations focused, building their own models, integrating them into the EHR, they have slightly different needs than the research takes sense.
Yeah.
And so what we had before couldn't serve all three of those use cases and audiences. So she said, hey, here's what we're going to need to be able to serve all audiences effectively and well, that's scalable. And we went about going that path. Then, as part of that, that's when, AI really just in the marketplace and across the world became this hot thing, even though it's been around for a long time.
It's hot right now.
And it's super, super hot, sunburst hot. But, she said, we started talking about, okay, well, where do we really need to go? And so we said, okay, if we go down the path, we can't really leverage the commercial versions of these tools because HIPAA, security, we can't have our PHI and PI being trained out in the public domain. That's just a non-starter. Mm-hmm. So we landed on, okay, well, if we do private instance, can we really build this out in a way that allows us to continue to take advantage of the capabilities that come with the commercially available options? Although it's probably not a one-to-one, will that be enough to sustain and allow us to create differentiation and to continue to build products against it to serve clinical and administrative? And the answer kept coming back, yes. So we said, okay, that's what we're going to do. So in the midst of creating this new data platform, we also said, okay, we can do that. And we're also going to start down the path with our own private. And that's how we came to the decision. It had to be secure. We had to feel like the capabilities were going to allow us to add to it and build things internally while still taking advantage of the native capabilities. And secondly, we wanted to make sure that we're not limited to one. We want to be able to access multiple models. And so that was also important. And all those answers kept saying, yes, that's the way. That's how we have to do this. And that's the path we've been on.
Yeah, that's the way to keep everybody's data secure and also develop new ways of doing things. How has that changed your decision making and your organization? Have you seen anything people should look out for? What's going great?
So adoption has to be a part of the process. So because of where we are with our integration, we still have a little bit more work to go over the next 18 months to complete all of the integration activities. Oh, wow. So it's not available to the entire health system yet. We have, we still have to connect and integrate our networks. That's coming over the summer. Once we're able to do that, then we can begin to give the broader audience of our workforce access to it. But so far, the groups that have been using it, it's been a knowledge base. And so we're getting really good traction there. We have a couple of products we built. Our marketing group, they do a lot of analyzing content that gets created by individuals in the organization. And of course, marketing has our brand assets. They want everything to really be crisp and following those guidelines. And it can be difficult because they'll produce more and updated ones. And how do you know? And how do you keep track of it? So they have spend a lot of time reviewing content for the individuals in the organization. So as they were sharing that, we said, okay, we think we can incorporate this into what we call RCH chat. And so we just released that. And basically what it does, you can upload your files, whether it's, whatever the version or type is, and whether it's a physician profile, whether it's a presentation you're giving at a conference, and you load it and it will go and find and compare our marketing brand guidelines and tell you whether or not you need to make any adjustments.
Ooh, the marketers at health systems are thrilled right now.
And so, we just released that, but we're super excited about it. I used it just yesterday for a presentation I'm creating for something next month. And so I didn't have to send it to marketing to do it. It just did it for me. They
could just look at it. I can't imagine. I really can't imagine just getting a deck and it works. Let's think about that, because I like that you're meeting actual needs of the organization and helping things be better for everyone involved. You mentioned stuff about EHR and that. Let's talk a little bit more about that, because you've spoken about moving past the EHR as your center of gravity. I listened to it and talking about building an AI data foundation underneath it. And for leaders who are still thinking of the EHR as the center of the universe, and for the EHR vendors on here, we're not saying you aren't, but what does that look like in practice? Like, what,
Right,
you
right.
have this timeline, you have the 18 months. What does that mean though?
Right. So our EHR, we're unifying on Epic, love Epic.
Yeah.
And they have tremendous capabilities. So it's not throwing shade on them. But the philosophy and approach to creating that infrastructure that you can build and leverage AI and Gen AI on top of has to be agnostic from my lens. And so what it looks like for us is we have a legacy of another EHR vendor that was prevalent, and we have a lot of that data. It's important. We're going to need to keep that. But as we unify on Epic over the next 18 months, we start to pipe in that data into the platform. So that's where the integration of the data and the assets from both legacy organizations come together. And that's where the power and the magic can begin to happen, because you have that combination and wealth of data across. So as we bring that over, the intent and goal is before we get to that unified EHR platform, we'll already have all that data in. We'll start to enable meeting with operations collectively. We'll be in the middle of implementing this EHR unification. So we'll already have sessions where we'll have some insights into what are they missing today, what are they going to need, what questions we need to answer. So we'll be able to glean some of those insights and start building some products against this newly integrated data platform. So it's not only just some visualizations that are going to be important for us to track and monitor performance, but it's also going to be some of those Gen AI products. So Ask the Data is what we call it. That just launched for folks on our census types of data elements. We're going to build that out even more over the coming months of the rest of this calendar year, so it becomes more robust. And as that Epic data rolls in, it just incorporates. And so by the time we get to that go live and unification of one EHR platform, we're going to exit with this wealth of insights that is going to be driven by this private LLM that we have invested in. And I'm super excited about it. And it means post go live, we'll leverage the inline reporting of Epic is important for the folks who are in it day in and day out. But for those who are having to analyze and forecast and look at things more holistically, what do we need to do in the next 90 days? It's going to give us capabilities that we didn't have at a speed that we weren't able to produce previously. And so that's what I really mean by moving past the EHR as the center of the universe. This combination of data and these AI tools becomes how everything happens.
Right.
Even though you have these things underneath it and these inputs that are coming from these core critical systems, that becomes the foundation and the core infrastructure for everything else.
Yes. Yeah. And then you're not held hostage by your legacy data. You're letting it add to your organization and contribute to a better system. What are the things when people are talking about this? What's the hardest part? And what do people not talk about enough? You don't have to call yourself out totally, but I think sometimes we only want to hear the good thing, but like, what are the conversations that are being missed?
The hard part is getting the data platform and the data organized and cleaned for use. You can't really leverage AI and really take advantage of it if you don't have a good organized data structure and platform. Obviously, with LLMs, you can search unstructured data.
Yeah.
That's important. But you have to, if you don't have it, then it's effort. It takes a long time to get that clean. So that's hard. Changing to a new data platform architecture is hard, because what you had before, you have to make a decision. Am I going to recreate all of the insights that I had before? And we didn't do that. And that hurt.
Yeah.
It hurt some of our customers. And then because of that, it damaged, what we had been doing previously by serving them. And so we have to perform service recovery. Even though, we felt we communicated, that's what was happening. We didn't do a good enough job. I'll say continuing to have that conversation and making sure they understood that. So that's hard. But once you get that piece done, then you can do all these other incredible things faster, more effective, and you can get to the really fun and cool stuff.
I love that. And I think too, when I was looking at your work, like getting to the good stuff is nice. I also like that you, in your work, always bring up how important it is to improve the patient and employee satisfaction at the same time and not trade one for the other. And I thank you for that story of like, sometimes when you change things get lost and then you have to fix it. So how are you using tools to uplift your clinician and staff experience? And how do you know when you've arrived? Instead of them just like being nice to your face.
Right. So, Ambient has really shifted and has really made a huge impact. So that's been a big win for us with our physicians. We can't roll it out fast enough. And they're going to, we survey and we say, tell us what you think. And they're telling us, they'll stop you in the hall and tell you. So they're giving it feedback. So we have to have that closure. We can't just rely on, well, here's what the metrics and the data is showing, how well you're using it. You also have to get that feedback from them, the qualitative feedback to say, is the data matching their actual experience? That you always have to do those two things. So that's how we approach it and do that. We're looking at care guidelines, introducing that into the mix with the Gen AI platform. And we're taking advantage of some of the epic things. The chart summarization, we released that in both inpatient and outpatient. So far, that's receiving good success and feedback from physicians. But we did it small. We want to make sure that they see it's valuable. And once we feel like we have a good cohort that says yes, then we'll scale it out. And there's so much more that we'll do in that manner. But we don't want to just do it big bang. We want to do it small and say, tell us if this is really helpful. And when they say yes, then we can scale it out and roll it out.
I love that. So always have to do one technology thing and one person thing. So that was a great way to close out our day. And I want to thank you for your work and for sharing some of those insights.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.